नमस्कार एंड वेलकम टू RCI नवशिखर चैनल। RCI के नवशिखर चैनल में हमारे सभी दर्शकों का स्वागत है। आज के हमारे प्रोग्राम का टॉपिक है एड्रेसिंग सेंसरी इश्यूज इन चिल्ड्रन विद ऑटिज्म एंड टुडे वी हैव विद अस मिस रचना गिरी, occupational therapist from Navjyoti Institute for Mentally Challenged, and Miss Nusrat Al Hassan, occupational therapist from Action for Autism. Welcome to RCI Navshikar channel, ma'am.
Thank you so much.
Thank you. Progressing further, I would like to inform our viewers that they can call us for their any queries. हमारा टोल फ्री नंबर है 1800-112008. हमारा स्टूडियो नंबर है 265-11613 और हमारा फैक्स नंबर है 265-11609. जैसे कि आज हम बात करेंगे सेंसरी इश्यूज के बारे में एंड बेसिकली हाउ टू identify the sensory problems and how to intervene these sensory problems in autistic children. Basically, first to deal with what is autism. As we have discussed earlier, autism, it's a neurodevelopmental problem. It's a neurodevelopmental problem which is attributed by the further problems in language area, in social skills and the communication skills. Plus there are many repetitive and odd behaviors and also there are sensory issues as well. तो बेसिकली आज जो सेंसरी इश्यूज हैं जैसे टैक्टाइल हो गया, काइनेस्थेटिक हो गया, ऑल्फैक्टरी, ऑडिटरी, विजुअल, इन सब के बारे में आज हम विस्तार से बात करेंगे. तो चलिए हम अपने एक्सपर्ट से पूछते हैं. बेसिकली जो आज हम बात करेंगे सेंसरी इश्यूज, आप हमें थोड़ा स्टार्टिंग में इंट्रोडक्शन देना चाहेंगे कि व्हाट आर दीज सेंसरी इश्यूज बेसिकली इन चिल्ड्रन विद ऑटिज्म.
Okay. So basically when we deal with the sensory issues in autism, there are mainly 7 senses that we deal with. So mainly it is tactile, vestibular, proprioceptive, then we have gustatory, olfactory, vision, and then
Auditory.
Gustatory.
Okay.
And olfactory. So these are the 7 senses that we deal with. Basically when we talk about sensory integration, it deals mainly with 3, that is tactile, proprioceptive and vestibular.
Okay.
So integrating all these 3 senses leads to the improvement in adaptive responses in a particular child.
तो ये जो सेंसरी इश्यूज है, जो सेंसरी प्रॉब्लम्स है, अपार्ट फ्रॉम ऑटिस्टिक चिल्ड्रन, क्या और भी हम जो डिसेबिलिटीज उनमें देख सकते हैं?
उनमें देख सकते हैं, लाइक इन MR चिल्ड्रन, लाइक ADHD, LD children have many sensory problems. Even CP children have sensory problems. Sensory integration is not basically only for autistic children.
Okay.
It can be applied to other disabilities also.
तो आज जो हम सेंसरी इश्यूज डिस्कस करेंगे या उनको इंटरवेन करने के तरीके देखेंगे, वो नॉट जस्ट हम एप्लीकेशन का ऑटिस्टिक बच्चों के साथ कर सकते हैं, बट दूसरी डिसेबिलिटीज जिनमें वो सेंसरी प्रॉब्लम्स है, हम वहाँ पे भी उनको अप्लाई कर सकते हैं.
Yes, definitely.
कैन वी हैव अ लुक एट द स्लाइड्स प्लीज? तो आज हम बात करेंगे बेसिकली सेंसरी इश्यूज. और जो सेंसरी इश्यूज हैं, जैसे कि मैम ने बताया, बेसिकली 7 सेंसेस के बारे में है. एंड ज़रूरी नहीं कि जो सेंसरी प्रॉब्लम्स है सिर्फ ऑटिस्टिक बच्चों में ही पाए जाए, ये दूसरी भी डिसेबिलिटीज़ हो सकती है, जैसे मेंटल रिटार्डेशन या सेरेब्रल पाल्सी या ADHD. तो ये जो सेंसरी इश्यूज हैं एंड हाउ टू इंटरवेन देम, आज जो हम सीखेंगे वो हम it's an application onto the all kind of disabilities in which the problem of sensory integration or the sensory issues is there. So can we have a look at the slides, please?
Yeah, sure. Okay, so first we'll see that how can we define autism. So it is a developmental disorder of brain function which is manifested in 3 classic symptoms. So first is impaired social interaction, that is the child is unable to interact, with the other people. It is like either through gestures or through expressive language or through receptive language. Then the child has difficulty with verbal and non-verbal communication and severely limited activities and interests. Like autistic children, they show certain repetitive behaviors. Like they are more interested in like rotating objects. They keep on looking at them. So this is just an example.
जैसे बॉडी रॉकिंग वगैरह हो गया.
Body rocking, yes, of course. That is related to the vestibular input and proprioceptive input. To seek that particular input, in whichever sense the child is lacking or hypo or hyper, the child would seek that particular symptom from the environment in any way.
Okay, it means it's not a problem at all. It's because they want stimulation. That's why they.
It is their need. It is their need. It is. There is a term we call it sensory diet.
Okay.
So like we eat every day, so they also need it every day. It is like that.
Okay. Can we have a look at the further slide?
Yeah. So the basic systems that we look into, they are the somatosensory system, the vestibular system, the auditory system, and then the visual system. So we'll look into one by one. I mean into all the systems.
Okay.
Okay, first we talk about the somatosensory system, that is mainly tactile. So the receptors, they are present in the skin and around the joints. So that here comes the role of the proprioception. Then there are two major subdivisions which carry information from the body to the central nervous system. First is the dorsal column system and second is the anterolateral system. So both these two systems, they carry different senses to the brain, but these two systems, they don't work in isolation. There are many reciprocal connections and both these systems, they influence each other.
मैम जैसे आपने बात करी बेसिकली द सोमैटोसेंसरी सिस्टम इट
Yeah.
बेसिकली कंप्राइज ऑफ द प्रोप्रायोसेप्शन थिंग
And tactile, basically
And
tactile and proprioception.
तो if you want to define what is proprioception, so what is that?
Proprioception is the position sense that we get from our joints and muscle spindles. So that is where our body is in space.
Okay.
So that is basically proprioception.
Like if we close our eyes and we are moving our limbs, so we know
Yeah,
like in which
definitely.
direction
Yeah.
the limb
Like
is.
if I close my eyes and I keep my hand like this, and the other person asks me to keep the other hand in the same way. So keeping my eyes closed, I should be able to keep my hand like this. So
Okay.
this is proprioception. I have that sense, like where is my body part in this space,
In
and I
this
can reciprocate it with the other part.
Okay, so basically the somatosensory system it comprises of the proprioception and the tactile thing.
Tactile.
Then moving on further.
Yeah. So, okay, the dorsal column, it carries information about the tactile discrimination. It is like how do we discriminate the different tactile inputs. It is like the soft, or how is the texture of a particular thing. It is whether soft, whether it is hard, whether it is rough. So that is basically tactile discrimination. Then we have vibration sense, then touch, pressure, proprioception, temporal and spatial aspects of a stimulus. Then we have the anterolateral system. It translates the pain, temperature, light touch and tickle from the various body receptors to the CNS.
Okay, and you're saying this temporal and the spatial aspects of a stimulus. What is that?
Yeah, temporal and spatial aspects of a stimulus mean from within the environment. It is like one is the sense of a particular person. It is like if I am sensing my own body, that is one thing, and the other thing is I'm sensing the environment. That is the temporal. Temporal basically means time and spatial. Spatial means whether it is above, whether it is on the right, whether it is from which side, direction, everything. So
Okay.
these two aspects of a particular stimulus.
Okay.
Okay. Then proprioception, I mean this is really important, like proprioception and vestibular input, they are connected functionally. So if we are working on the vestibular system, so that is in turn we are working on proprioception as well. There is no need. This is what sensory integration is all about. There is no need to work on one sense in isolation.
Right.
Okay, if we work in all, I mean if we work for all the senses together and we are asking for an adaptive response, that is sensory integration. Otherwise it is just plain sensory stimulation.
जैसे आपने अभी हमें proprioception के बारे में बताया, vestibular it's related to balance or what?
It is related to balance and it is related to your body in space basically against
Okay.
gravity. Like if we tilt our head towards this side, the whole body will react accordingly because the COG, the center of gravity, will shift. So all these processes, they are the function of the vestibular system.
Okay.
So the receptors, we'll talk about that vestibular system later on.
Okay.
Then okay, so proprioception and vestibular input, when they work together, that will lead to the function of body scheme. The child would develop postural responses, postural tone and equilibrium, stabilization of head and eyes during the movement. All of these are lacking in children with ASD or autism.
मैम आप ये जो हम कह रहे हैं postural responses, postural tone and ये equilibrium, इनको explain करना चाहेंगे?
Yeah, sure. Postural responses, as you asked, postural responses are like the same thing that I've told. Like the center of, when we stand straight, the center of gravity is in a straight line. Okay, the moment somebody give us a jerk, okay, the COG, the center of gravity, it shifts, and accordingly our whole body, the postural responses, either will take out a hand or we will also stoop.
Right.
Okay, so these are the reactions that the body shows. I mean that these reactions prevent us from falling.
Okay.
So that's why such children, they have that fear of movement.
Okay.
So because the postural responses, they are lacking. Then we have postural tone. Tone, what we say is the tone is the contraction of a particular muscle at rest. Okay. So in such children, the tone is usually hypotonic. Okay. Hypo means it is less than what is required.
Okay. मैं मैम से पूछना चाहूँगी
Yeah,
मैम
sure.
जैसे मैम ने पोस्टल रिस्पॉन्सेज के बारे में बात की, तो आर दे द प्रॉपिंग रिएक्शंस और जो हम टिल्ट रिएक्शंस की बात करते हैं, तो ये क्या वही है पोस्टल रिस्पॉन्सेज?
Yeah, it is related to that also, because the posture responses and the equilibrium, they are together, they are combined, and then the person gives the response. So what you are talking about, the tilt reaction, is more of an equilibrium.
Okay.
So but it is connected to the posture response, because they work together.
Okay.
Like if the person is having the equilibrium reactions are that are integrated, that then only the person can give the posture responses.
Okay, like if we are sitting here and somebody give us a joke from this side, so we'll like ऐसे stabilize करेंगे ना, that's
or
what
we will shift, or we will in any kind of an equilibrium. We are maintaining our equilibrium. That is how we get the posture responses.
Okay. Then moving further.
Yeah.
What is anpostural tone? It's to maintain the normal tone of the body.
Tone is basically the muscle contraction that is required for, like, if we are sitting like this, if we don't have tone, we'll be like this. So flabby. Okay, so that means the tone is less than what is required, than what is normal.
Means that helps us to stand against the gravity.
Against the gravity, yes.
Okay. Moving further.
Yeah. Then there is trigeminothalamic pathway. It carries all the somatosensory information from the face to the CNS. So when we talk about face, I mean the child is usually hyperactive for touch on the face. I mean the child will not allow somebody to touch on the face, or he will not allow to put lotion or soap, or even to brush. Brushing is a different thing that comes in gustatory. But so it is a trigeminal nerve which carries all these sensations to the central nervous system.
Okay.
So when we treat, I mean there are many other techniques like skull tapping, or there is facial tapping, so which are used to desensitize these particular aspects.
हम जैसे मैम ने हमें बताया कि हाइपर सेंसिटिव एंड हाइपर सेंसिटिव, तो यूजुअली जो ऑटिस्टिक चिल्ड्रन होते हैं वो कौन सी वेरिएशन में आते हैं, इधर हाइपर सेंसिटिव और हाइपर सेंसिटिव?
It can be a both. It doesn't, even in the same body, even in the a single person can be a hyperactive at the one part and the hypoactive at the other part. So it can be the combination of both. Even it changes as the person gradually develops. So as there are the kind of a variations. Sometimes they are hyperactive, and after a period of a time they can show the hyperactive reactions.
Okay, means
So
अगर
it's a
hyperactive है, okay, अगर hyperactive है, and if we have given the proper intervention, the chances are that they can be converted to the hypo thing.
So we don't want them to convert to the hypo. We want them to in a normalized.
Okay.
So these are the two extremes. Hyper is the one extreme and the hypo is the other extreme. In between there is a normal range.
Okay.
So every time we give the intervention, we want the person to be in a normalized.
It is a continuum. It is like hypo and hyper.
Okay.
If the child is hyper, we will try to bring him to the center.
And
if the child is hyper, again the intervention would aim to bring him here
Center.
at the center only.
So it's the part of the continuum, the hypo and the hypo. Okay. Then moving further.
Yeah. Then we talk about the vestibular system. The vestibular system, the receptors, they are the hair cells within the inner ear. So they are basically otolith organs and the semicircular canals. Both these function in a different way. The otolith organs, they respond to the linear movement and gravity, like head tilt in any direction. And semicircular canals, they respond to the angular movement, which are based to the transient and quickened movements. So these two things, I mean, if the child is showing rocking movements, and if the child is moving like this, that means the child requires vestibular input in the linear direction. So the therapy would basically focus on that. If the child shows rocking movement, somebody like this, okay, so that means that we should aim at the semicircular canals. Okay, and the movements, when we give the semicircular canals, there are many things to focus on, like the speed, the accuracy, the direction in which we give, like clockwise, anti-clockwise. So basically we should give therapy, we should focus on both the otolith organs and semicircular canals.
हम कई जैसे बच्चे होते हैं, they like to be in the swings for most of the time, like almost all the day. So that's the problem with the vestibular system.
They are hypo. They are hypo to the vestibular system. So that's why they are seeking more. So there are other categories of children, I mean, which are hyper to vestibular system. Okay, like somebody, some child who is crying in a car, or who cries in a bus. So that child is hyperactive to the vestibular input.
Okay.
I mean, just a little bit of vestibular system input will be too much for them.
Okay.
So for them the therapy would be different.
ओके. और मैम जैसे हमने बात करी कि देयर हाइपो, जो सारा दिन मतलब स्विंग्स पे रहते हैं, तो क्या उनको स्विंग्स पे रहने देना चाहिए? बिकॉज लाइक पूरा दिन इट विल बी लाइक मोर ऑफ अ नॉजिया काइंड ऑफ थिंग. तो व्हाट्स द प्रॉपर थिंग दैट वी हैव टू डू?
Actually, there's we need to, this sensory integration, it is given throughout the day, but it is not given all the time the child has to be on the swing. It is intermittently these are given. There are some, ideally we say that thrice a day it should be given, or 2 hours, or after every 2 hours we need to give that, because they need this so that their sensory system and that they are alert enough to learn something. So these are given gradually and intermittently after every 2 hours or thrice a day. This is what we suggest to everyone.
Okay, then moving further.
Then we talk about the visual system. The visual system, the receptors are rods and cones. The rods, they respond to night, that is dim light, and the cones, they respond in the daylight. There are 3 pathways: the lateral geniculate pathway, the superior colliculus pathway, and the accessory optic tract pathway. So the visual system in autism, I mean, it is basically related to, I mean, like there are some children who are very they need, again, in all the systems there will be hypo and there would be hyper. Again, a continuum within each system. So there would be some children who are hypo to the vestibular, I mean the visual system. So they would require more light. We need to give them more visual input. And there are certain children who will not even, I mean, they cannot tolerate even a small amount of light. So we need to desensitize them. Okay, so the basic principle remains the same, bringing the child from the 2 extremes of the continuum to the midline of the 2.
जैसे आपने बताया कि अगर hyper sensitive है light के, तो whether he should be placed into a dark room or what, like where the minimal
gradually it would be like a desensitization kind of a program. Like we will start from the dim light, then again brighter than that, then brighter than that.
Okay.
So again it is like that.
और मैम जैसे हमने कई बच्चों में देखा है कि they do like they wag their finger in front of their eyes, so that's also the same thing.
Yeah,
that
that's the same
they seek the visual stimulation.
So it can be both. So we need to do an extensive evaluation for that. It can be a both. It can be because they want some movement in their fingers. It can be they want that, because when we do this we get a stimulation at the joints.
Right.
So it can be both that. But when the child is persistently doing this in front of his eyes, so we think that it might be because of the visual thing. But we need to address the both things, and we need to evaluate the both things, whether it's in because of the joints he wants to do the finger movements, or whether it's because of the visual thing he wants to do.
Okay.
After an extensive evaluation we come to the conclusion that, and we don't take the risk of, we provide the kind of in therapy to the both the things, and wherever we get best results we stick to that.
और जैसे जो आई कॉन्टैक्ट लैकिंग होता है ऑटिस्टिक चिल्ड्रन में, बेसिकली बिकॉज ऑफ द हाइपर सेंसिटिविटी और व्हाट इट्स अ जनरल प्रॉब्लम, और बिकॉज ऑफ द हाइपर सेंसिटिविटी, व्हाट्स दैट?
Actually, it's combination of the both. Every behavior has many aspects, we can say. If like the eye contact lacking, it can be because of the sensory thing also. It can be because of the other behaviors. Because the child is avoiding the person, that can be because of the social behavior, that social interaction which they are lacking.
Right.
So for one particular behavior, you need to rule out what are the various functions of that kind of an behavior.
ओके. और मैम ये जो जैसे ट्रैकिंग एक चीज़ है, अगर हमें आई कॉन्टैक्ट डेवलप कराना है तो ट्रैकिंग एक चीज़ है, तो ये भी सेंसरी इंटरवेंशन का ही पार्ट है? इट्स एन अदर थिंग जो हम ब्राइट लाइट से इल्यूमिनेटेड ऑब्जेक्ट से ट्रैकिंग कराते हैं टू डेवलप द आई कॉन्टैक्ट, इट्स अ पार्ट ऑफ अ सेंसरी इंटरवेंशन.
It is a part of the visual perceptual system of our body.
Okay.
So that can be incorporated into sensory integration also. Like the visual system, such children, they lack visual tracking, visual fixation,
Right.
then saccades and all these things. So we need to, if the child is lacking, then definitely we can combine that particular thing in sensory integration.
Okay, then moving further.
Okay, now coming to the auditory system. The hair cell receptors function in the same way as the vestibular system, as two are very closely interconnected. The auditory inputs, they are integrated with the somatosensory inputs in the superior collicles to play a role in control orientation of the head, eyes and body to sound. Okay, so the auditory inputs and the somatosensory means the tactile inputs. Okay, so the tactile it plays a very important role because the vision, that is also affected. So just by touching the objects the child is feeling. Okay,
Right.
so that in that sense tactile plays a role. So both these systems, the orientation of the head, eyes and body to the sound, like there are auditory system also, it has meanings like auditory sound, from where it is coming, then auditory discrimination, like which sound it is. So all these things they are lacking in these children also.
ओके. और जैसे आपने हाइपर सेंसिटिव के बारे में बताया था, मुझे याद आ रहा है जैसे जी टीवी पे एक शो आता है आपकी अंतरा करके, तो देयर वाज अ सीन कि देयर ऑल द फैमिली वर सिटिंग इन अ रेस्टोरेंट एंड वहाँ पे एक बर्थडे सेलिब्रेट होता है, बर्थडे पार्टी, एंड शी वाज लाइक जस्ट क्लोजिंग हर ईयर्स बिकॉज ऑफ दैट पर्टिकुलर नॉइज. So that's a kind of the problem with the auditory system.
With the auditory system.
Okay. Then moving further.
Yeah. Now coming on to the sensory integration, like till now we have talked about the various sensory issues in autism. Now we'll be talking about how to deal with those particular issues. So how do we define sensory integration first? So sensory integration, it was given by Jean Ayers. She defines sensory integration as the neurological process that organizes sensation from one's own body and from the environment and makes it possible to use the body effectively within that particular environment. So both the aspects are important. Getting the stimulus from our own body, that is the proprioception, the
Right.
everything, and from the environment also. Okay, so that is the temporal and the spatial aspects of the environment that we talked about.
Okay, मतलब
Okay.
like अगर हम from one zone sensation की बात करें तो proprioception के बारे में बात करें.
Proprioception, tactile we get from the environment basically.
Okay, and partly from one's own self and partly from the environment.
Yeah, and then integrating. I mean, like now, if we are sitting here, we are getting many stimuli from the environment. Okay,
Right.
so we know which stimuli we should register. I mean, and respond to. But these children, they have registration problems also. They don't know. I mean, which stimulus is important for us and which stimulus is not. So whatever stimulus they want, they just seek that particular stimulus.
So we can explain it in the sense like there's a chaos created of every
Total
instrument,
chaos.
yeah, total chaos. So that we have to intervene in between.
Yeah.
Then moving further.
Yeah. Okay, so the sensory integration is based on certain assumptions. So we'll take them one by one. The first is the central nervous system is plastic. So, okay, so this means that the central nervous system can evolve. Okay, so it is not like, so that's why we say the earlier we start the intervention, it is always better. Okay, because in the earlier years it is still developing. I mean, like if we say till 5 years of age, the central nervous system is developing. Okay, so at later ages also it is always adaptable. Then sensory integration develops.
Okay. मैम आप ये points read कर देंगे पहले?
Okay, sensory integration develops. Third is the brain functions as an integrated whole. Fourth is adaptive interactions are critical to SI, and people have an inner drive to develop SI through participation in sensory motor activities.
Okay. Now
Right.
can you explain that?
Okay, one by one.
Yeah.
Okay, first one I have already explained.
Yeah.
Okay, so it is plastic. So we can this basically means that we can modify central nervous system through intervention. It is not something that is fixed. Okay, by birth.
जैसे हम बात करते हैं आपने बताया up till 5 years of age, so that's a critical period.
That is the critical period.
Okay. And after that अगर हम उसके बाद intervention start करें तो कितने chances हैं कि yeah we can bring them to the normal continuum?
Improvements will be there, but not at that pace. I mean, which would have been at an earlier age.
Okay.
Okay.
Then what is the next
Then
point?
sensory integration develops. Okay, it is not like the person. I mean, the infant who is born, he is not born with all the sensory. I mean, the child develops sensory integration at particular points in life. Okay,
Okay.
it is not by birth.
मतलब
Okay.
अगर हम normal children की बात
Normal,
करें,
yes.
okay.
Typical developing children, if you talk about, they also develop sensory integration as they grow.
Okay.
So it is like at that particular critical periods, if we give appropriate intervention to these children, there are chances that they will develop sensory integration at a faster rate.
और जैसे अगर हम normal की बात करें तो first I think तो visually होता है because जो visual होता है auditory होता है.
Tactile.
जो आपने बात किया
सबसे
ना
पहले
sensory-
जो
हाँ
develop,
जी.
that is tactile.
Tactile.
Okay,
It is
tactile.
first
हाँ,
which develops.
First
And
which
then
develops.
next
The next.
Visual.
Visual. Okay.
visual. Okay. Then what is the next one?
Okay, the brain functions as an integrated whole. Okay, so it is like there are various parts of the brain. Okay, so but that does not mean that each part will function in isolation. Okay, all the parts of the brain, they accumulate information from the environment and they make sense of it, all the parts together of the brain. So that's why we say ki sensory integration
Right.
means integrating all the senses, because the brain itself is not working in isolation.
Okay.
Okay.
मतलब लेकिन अगर एक पर्टिकुलर सिस्टम में प्रॉब्लम है, सोमैटोसेंसरी सिस्टम में प्रॉब्लम है, तो वील डील विद द प्रोप्रायोसेप्शन, द टैक्टाइल
Okay.
थिंग. तो वहाँ पे हमने सिर्फ उन दोनों का ही इंटीग्रेशन
Okay,
किया.
see, I mean, when we talk theoretically, it is very easy to say, okay, this system. Okay, this is just for our own sake that
Okay.
we talk about. But all these systems are interrelated to each other. There are various projections which are coming out from one system and going to the other. So
Okay.
every system influence each other. It is not like only one system. No system in body works in isolation.
Okay.
It is like
So
that.
we'll carry on with our discussion of the assumptions after a short break. See you after a while.
ऑटिज्म एक व्यापक विकासात्मक विकलांगता है जिसके लक्षण जीवन के प्रथम 3 वर्ष में ही दिखाई पड़ते हैं, जैसे असंगत खेल, असमान स्थूल एवं सूक्ष्म गामक क्रियाएं, शाब्दिक संकेतों पर अभिव्यक्ति न देना।
Where is the cup? देखो, open your eyes, open करो, open करके, open.
नियमित कार्यक्रम परिवर्तन का विरोध करना एवं अवलोकनीय शारीरिक उच्च स्तरीय या निम्न स्तरीय क्रियाकलाप। UNCRPD 2007 सेक्शन 1 ऑफ आर्टिकल 4 निशक्तता के क्षेत्र में कार्यरत प्रोफेशनल के प्रशिक्षण पर महत्व देता है। ऑटिज्म के क्षेत्र में सरकारी एवं गैर सरकारी संस्थाएं कार्यरत हैं, जो भारतीय पुनर्वास परिषद द्वारा पंजीकृत हैं। सोसाइटी फॉर एडवांस स्टडी इन रिहैबिलिटेशन एक ऐसी ही गैर सरकारी संस्था है। कनिष्क 13 साल का एक ऑटिस्टिक बच्चा है जो इसी संस्था से प्रशिक्षण प्राप्त कर रहा है। असंगत क्रियाएं, कार्यकलापों में निरस्ता, असमान स्थूल एवं सूक्ष्म गामक क्रियाएं जैसे बॉडी रॉकिंग और फिंगर रिगलिंग उसमें देखी जा सकती है। उसे मैचिंग और पेस्टिंग, पॉइंटिंग जैसी क्रियाएं सिखाई जाती हैं।
Very good. Glass. Where is the glass? Glass. Very. कप को टच करो जल्दी से। कप को। Where is the cup? Very good. कप में क्या करता है कनिष्क? टी पीता है। चलो ग्लास। Where is the glass? Very good. चलो बाउल की तरह, बाउल जल्दी से टच करो बाउल को। Very good. बाउल में क्या करता है कनिष्क?
तथा साथ ही साथ रोजमर्रा की आवश्यकताएं जैसे खाना, पीना, कपड़े पहनना, और व्यायाम संबंधी प्रशिक्षण दिया जाता है। ऑटिस्टिक बच्चों को भिन्न भिन्न प्रकार की कार्यविधियां उनके स्तर के अनुसार सिखाई जाती हैं, जैसे कुछ बच्चों के लिए कलरिंग विद इन वन एरिया, मैचिंग एंड आइडेंटिफिकेशन, फाइन मोटर स्किल्स, आई हैंड कोऑर्डिनेशन, कंसेप्ट ऑफ वेजिटेबल्स, फ्रूट्स, बॉडी पार्ट्स, कलर्स पर जोर दिया जाता है तथा कुछ को प्रश्न पढ़ के उत्तर देने में और रोजमर्रा की आवश्यकताओं को पूरा करने में सक्षम बनाया जाता है। इसके अलावा राइम्स, डांसिंग, सिंगिंग द्वारा लेजर एंड रिक्रिएशनल एक्टिविटीज में भाग लेने के लिए प्रोत्साहित किया जाता है। इन सभी कार्यकलापों एवं प्रशिक्षण का एकमात्र उद्देश्य उन्हें स्वनिर्भर बनाना है, ताकि ये डगमगाते पांव सक्षम बन जीवन के एक एक पायदान पर दृढ़ता से आगे बढ़ें और अपनी मंजिल को पा लें। एक तारा टिमटिमाता, उसने आकाश को छू लिया। एक लौ जली कहीं, उसने अंधकार को मिटा दिया।
वेलकम बैक। ब्रेक पे जाने से पहले वी हैव डिस्कस्ड सर्टेन सेंसरी इश्यूज एंड द इंटरवेंशन पार्ट. Basically, first we described about the autism. Autism, if we talk about, it's a neurodevelopmental impairment with the problems in the language development, social skills, communication skills, and also there are sensory issues, as we're going to discuss now. So there are different kind of sensory issues if we are going to address them. First is the somatosensory system, basically which comprises of the proprioception and the tactile thing. And then we discussed about in this system about the developing of the postural responses, the postural tone and the equilibrium. Then we discussed about the vestibular system. Basically, अगर somatosensory system की बात करें, then the receptors are around the joint. And if we talk about the vestibular system, then the receptors are within the hair cells. Then we talked about the visual system. Basically, the receptors, these we can say the rods and the cones. And then we talked about the auditory system. Basically, it comprises of the orientation of the head and the body to the particular noise or the sound. Then we discussed about what is sensory integration. Basically, integration, that is just to combine like the sensation from one's own self and from the environment. Next, we were discussing certain assumptions like the central nervous system is plastic and the sensory integration, it develops gradually and steadily. Then we're discussing about the brain functions as an integrated whole. Would you like to explain this point now?
Yeah, sure. Okay, so the brain functions as an integrated whole. Okay, so this means that the various parts of the brain, okay, they does not function in isolation. So they influence each other. Like that we have the hierarchical system that we still talk about. The higher centers in the brain, they influence the lower centers. So
Okay.
that is what it means basically.
Okay. So
Then-
like by stimulating the higher centers, the lower centers are like they're
No.
okay.
No, it is not like that. It is like the brain functions as an integrated whole means like all the sensations we need to address. I mean the one if we are telling about if we are talking about movement, okay, so basically the cerebellum, the basal ganglia, they will deal with the movement part.
Okay.
But that does not mean only the cerebellum. Okay, the connections which bring information
Okay.
from the body to the cerebellum, if they are affected, then the cerebellum will not be able to function properly. So it is like all the central nervous system, the peripheral nervous system, everything. I mean basically we are talking about CNS here.
Okay.
That the central nervous system, it functions in as an integrated whole, as a one entity.
Okay.
Okay. Then the next is adaptive interactions are critical to SI. Adaptive interactions means while giving the SI, that is the sensory integration, the child is interacting with you. For example, if to give the vestibular and proprioceptive input, you are making the child to jump on the trampoline. Okay, so at that particular time, if you are asking the child to give the eye contact, that is a particular adaptive response that you are asking for. Then people have an inner drive to develop SI through participation in sensory motor activities. So it is always better to give sensory integration through various activities. So but the child should have an inner drive, so which is very essential to sensory integration. Then sensory integrative disorders, they fall into 4 categories like sensory modulation problems, sensory discrimination and perception problems,
And then
vestibular processing disorders, and then we have the dyspraxia. Okay, so these are the 4 points. Then the first is sensory modulation problems. So in sensory modulation problems, the child is unable to modulate like the amount of a particular sensation that the environment is giving to a particular child. Okay, the child is unable to modulate that particular sense. Okay, that means the child is unable to decide like how much of that particular sensation he needs to take in and how much to respond to. So these are sensory modulation problems. Then sensory discrimination and perception problems. It is like tactile discrimination or auditory discrimination. The child is unable to discriminate between soft texture or a rough texture, as I've already told. And sensory like auditory discrimination also. The sound of a dog or the sound of a cow. I mean the child is unable to discriminate. Then we have vestibular processing disorders. Okay, now like the same, we have talked about the vestibular system earlier. So the same problems like rocking problem, all these problems. Then we have dyspraxia. Dyspraxia praxis basically means motor planning. Okay, so the child, it is again of the various kinds. Like the child with the autism, they are unable to wear their, I mean like they are unable, in ADL activities they are not appropriate, they are unable to do those activities appropriately. So that means constructional or dressing apraxia. It means the child is unable to dress himself or herself properly. So in that case we can train the child in those particular activities.
like if the obstructions are there, then he'll not be able to plan his or her way.
Yes,
That's the thing.
exactly, motor planning.
Okay.
Okay.
जैसे मैम बात कर रहे हैं हम यहाँ पे सेंसरी इंटीग्रेटिव डिसऑर्डर्स की, तो पहले भी हमने बात किया इधर हाइपर सेंसिटिविटी हो गया, हाइपर सेंसिटिविटी हो गया, या हमने बात किया कि सोमैटो सेंसरी वेस्टिबुलर इन सिस्टम्स के बारे में. ये कहाँ पे स्टैंड करते हैं? व्हाट इज लाइक सेंसरी इंटीग्रेटिव डिसऑर्डर्स? क्योंकि हमने प्रॉब्लम्स के बारे में तो पहले भी बात कर ही ली है. व्हाट आर दीज बेसिकली?
Actually, these are the we through this sensory integration disorders, we try to understand where the problem exists. Is it that the child is not taking in the sensations? That's the registration problem.
Okay.
Is the problem that the child is अंदर तो जा रहा है sensations that the child is taking in, but the brain is not properly functioning? That's a modulation problem.
Okay.
That we can say that the child तो sensations ले रहा है, but the thing is कि वो जो हमारा modulation है कितना filter करना है, how much filtration we need to do, the child is lacking in that. और इज द चाइल्ड अंदर सारी सेंसेशंस जा रही हैं, CNS के पास भी जा रही हैं, बट डिस्क्रिमिनेट नहीं कर पा रहा है.
Okay.
सो वेयर द चाइल्ड, व्हाट इज द चाइल्ड्स लेवल?
जो हम CAPD की बात करते हैं, इट्स द सेम थिंग, द सेंट्रल ऑडिटरी प्रोसेसिंग डिसऑर्डर मींस द जो इन्फॉर्मेशन है वो जा रही है बट दे आर नॉट एबल टू प्रोसेस.
हाँ, it's a kind of a, we can say that, because we need to find out कि is there a problem in registration, is there a problem in modulation, discrimination, or any
Okay.
other functional outputs में, क्योंकि there are always the levels in the child. We can see the severely autistic child, we can see mild autistic child, there are high functioning autistic child. So we need to actually find out कि where the problem exists, so that our program which we give the sensory integration therapy, that should be that should be equal to the child's level. हम ऐसा तो नहीं करें कि हम कुछ और दे रहे हैं और बच्चे का कोई और प्रॉब्लम है. We need to, these are जो बच्चा साइन शो कर रहा है, the symptoms which the child is showing, that means that is that hyper or is that hypo, but what the actual problem is, this is the sensory integration disorders.
मैम ये जो हम असेसमेंट की बात कर रहे हैं, तो बेसिकली हमारे पास कोई चेकलिस्ट वगैरह है, कुछ असेसमेंट प्रोसीजर ऐसा है कि जिससे हम देख के वी कैन लाइक मार्क आउट द पॉइंट्स वेयर द प्रॉब्लम एक्चुअली इज?
The very important assessment tool is the observation. Very
Okay.
important. It is observation through the professionals, is the observation by the parents, and because observation through there are other checklists also, like there are the sensory profile, sensory history, or the adult in autism interventions. But the thing is that observation, जब तक हम observe नहीं करेंगे बच्चे को, maybe we may interpret the wrong information. Parents ने कुछ ऐसा कहा और मैंने उस चीज़ को observe नहीं किया, maybe we may interpret the different. There we need to find out कि कहाँ पे disorder है, is the registration, modulation, dyspraxia, where is the problem? So we need to do a we can say a vast observation.
ओके. और ये बेसिकली जो डिस्प्रैक्सिया के बारे में बात किया, ये स्पेशली ऑटिज्म में ही पाया जाता है या और किसी डिसेबिलिटी में भी, जो डिस्प्रैक्सिया, मोटर प्लानिंग?
No, बाकी सब में भी पाया जाता है. इवन व्हेन देयर आर द पोस्ट इंजरी केसेस, पोस्ट ब्रेन इंजरी केसेस जिनमें होता है, देन आल्सो दे हैव दिस डिस्पैक्सिया.
ओके. और मैम जैसे आपने हमें बताया ये सेंसरी इंटीग्रेटेड डिसऑर्डर्स, इनका जो intervention है, आप you will tell it later on or you want to explain, like for modulation problems what we have to do, for discrimination perception problems what we have to do?
Okay, so it is basically what Nusrat has told. I mean, like sensory modulation problems, it is like अगर registration में problem है, then we will focus on that particular area. If the child is registering, if the child has problems in modulation, so basically we have to deal with all the senses together, and then we see the improvement in these areas. Okay, automatically. Okay, so there is no objective scale. I mean, the assessment of an autistic child is very subjective. Okay, so there is no objective data that we can say the child is lacking in this, and after sensory integration the child's scores will increase into this. Okay, again the improvement is also very observational. Okay, the parents would say, okay, we are observing various changes in my child. Okay, so it is again that we cannot put it in points. Okay, so it is like that.
लेकिन अगर जैसे आपने बात करी रजिस्ट्रेशन की, अगर हम की एग्जांपल लें, लाइक इफ देयर इज ऑटिस्टिक चाइल्ड एंड ही इज नॉट रजिस्टरिंग द ऑडिटरी इनपुट व्हिच ही इज गेटिंग, तो हाउ डू वी स्टार्ट? What's the process?
First we have to look into the matter, like why the child is not registering. Okay, so there can be, it is like the child has never got exposed to that particular stimulus, or the child is, there can be some anatomical problems. So if there are some anatomical problems within the ear, then that has to be dealt with some surgeon or some ENT person. Okay, then the receptors, basically we have to look into the receptors. The child will register only when the receptors are functional. Okay, the other point is, if the receptors are functional but the connection between the receptors and the CNS, there is some problem between those connections, then we again the person, the surgeon or the doctor, that will come into that particular thing. Then the connections I mean, we see the afferent nerves. They go from the receptors to the brain, and they carry the information to the brain. If the information is not reaching the brain, then it is of no point.
And what is the role of an occupational therapist here? How he will like, ये सारी हमने initial points हमने देख लिए. Now, how to give the therapy? How to make him to register to the auditory stimulus which he is getting?
Okay, the auditory stimulus you're talking about. Okay, so we basically give auditory stimulus in different ways. It is like the auditory integration therapy. There is, okay, so we have various CDs that come into the market. So there are various levels of that. Okay, so we have there is one protocol which is known as Bernard's protocol. Okay, so in auditory integration therapy. So in this we give for 10 or 15 days, we give 10-minute session daily, okay, to the child, and that the child is exposed to a particular sound, okay, and then again, if the child is hyperactive to a particular sound, then we start with the milder, okay, and if the child is hypo, we start with the highest pitch of the sound.
And we have to initiate with the sound which the child is liking.
Yes, of course.
Okay.
That again is observational. That पहले आपको check करना पड़ेगा कि बच्चे को कौन सा which is soothing and which is calming to the child.
Like ये तो आपने हमें auditory के बारे में बताया. अगर हम visual के बारे में बात करें, then what is the procedure?
For visual system, again that I have told you before, like it is like again sensitizing the child. If the child is hyper, then we need to desensitize, and if the child is hypo, then we need to provide more visual inputs to the person.
मैम जैसे हमने एक्शन फॉर ऑटिज्म विजिट किया था, तो द स्पेशल एजुकेटर्स दे हैव अ लाइक पीरियड फॉर द सेंसरी इंटीग्रेशन, तो दे वर यूजिंग ब्रशेस एंड दे वर यूजिंग पल्सेस एंड दे हैव टू फाइंड आउट, द चिल्ड्रन हैव टू फाइंड आउट द स्मॉल थिंग्स फ्रॉम द पल्सेस एंड फ्रॉम द राइस. तो व्हाट्स दैट, व्हाट काइंड ऑफ इंटरवेंशन वाज दैट?
Actually, that was more of a tactile intervention which they were providing. But when you give when the sensory integration therapy is given in the class, so we took as a, one of the basic level we start from. It's not that we can't address all the children's sensory issues at a one time.
Right.
So what we do, that we try to find out the basic level of every child so that we can provide the therapy in a group sessions. So in that you must have seen the brushing and all, because all the children, most of them like the tactile stimuli when they are provided to them, most of them like that.
Right.
And the taking out the things from the dal, and it's something very functional. जब हम घर में भी बैठते हैं, most of the time we give the children something to do, and they start playing with the dals and all, pulses and all. That is how it's given in the class. So it's not something, because they are not technical, they don't have the technical knowledge as the special educators, but what they do, that they provide one of the basic level, what Rachna said also, this sensory diet, it contains the tactile, proprioceptive and the vestibular thing. So what we said, that in the class setting, most often you can give the tactile thing.
Okay.
Because that is easily available, and that is that everyone in the child group, they might like it.
Okay. And there is especially a mud bath, a mud play kind of thing. What's that basically for?
That is also the tactile thing, but they when you do the mud thing, they give a kind of a pressure to the they stick to the thing, and they give a kind of a pressure, and when you have to remove that, you have to apply some amount of a strength. So it's both the tactile and the proprioceptive.
Okay.
Mostly our activities are, they contain all these things: tactile, vestibular and proprioceptive. Most of our focus mainly is on these three activities. But it's not that we don't provide the integration in the other areas also. It depends on the child's need that we include the other sensations also. But these are the very basic elements which we need to include in the sensory integration therapy.
Like ma'am said, sensory integration as a whole.
Yeah.
As a whole.
Okay. And certain autistic children, like they'll press your hand like this, fingers. What's that like?
It's basically proprioception that they're seeking.
Okay.
Like pressing
The
their
pressure
joints.
sense.
This is again a form of therapy also. Like we give manual traction and compression to the small joints. Okay, starting from the small and then moving on to the proximal joints.
And what is that pushing and pulling? It's
Pushing and pulling is again compression and traction, mainly for giving the proprioceptive input.
और like वो जो therapy ball होता है हमारे पास, उसके पे बैठ के, that's for vestibular.
Vestibular.
Okay. Then moving on to the next slide.
Okay. So again, as she has already told, that there are sensory registration problems, sensation seeking behavior, sensory defensiveness. So these two things, like tactile defensiveness and there is gravitational security. These two things, they are very common in autistic children. Like tactile defensiveness is, if it is present in a child, that particular child is very hyperactive to touch. Okay, that child will not allow anybody to touch. So that is again tactile defensiveness. Many children, they walk on their toes. So that is again, they're hyper to the tactile. So they don't want their foot to remain on the ground. Okay, so they're that hyper. So again gravitational insecurity. This is particularly due to the vestibular problem. So gravitational insecurity means the child will not, the child is not comfortable if he moves above the gravity, against the gravity. Okay, so if we ask him to sit on that particular chair, he won't be able to do that. Okay, so that is gravitational. He will always be sitting close to the ground, always. So these two aspects, they are very commonly seen.
Then the next slide.
Then sensory discrimination and perception problems. Again, I've told like tactile discrimination and perception problems. Then we have proprioception problems and visual perceptual problems. Okay, we have already discussed about these three.
Right. मैम जो visual perceptual problems है, जो आपने बताया visual fixation and attention, they're that only?
Yeah. Visual perception includes all these things like fixation, then tracking, then saccades, then color identification, shapes identification, form constancy. All these things, they come in visual perception.
Okay. मैम अगर normal हम एक autistic child को we are giving the sensory integration, तो normal on an average कितना time लगता है to progress him to the normal range? Like from both the sides of the continuum.
Autistic children, they can never be normal. I would say that. Okay. There will be improvements, of course, but at least 3 months we need. Okay, so we won't be able to see any changes before 3 months. Okay, but that again, there are variations. There are certain children that respond better than other children, and there are certain other children, the more severe the child is, the longer it will take. So it is like that.
मैम जैसे आपके एक्शन फॉर ऑटिज्म में यू हैव सेंसरी इंटीग्रेशन क्लासेस लाइक आफ्टर द स्कूल इज ओवर, सो वहाँ पे जो पेरेंट्स जो हैं दे आर ऑल्सो अलाउड टू कम, सो डू यू ऑल्सो प्रोवाइड देम द एक्टिविटीज टू बी फॉलोड एट होम लाइक द सेंसरी इंटीग्रेशन?
The sensory integration, what we call the diet, because it's called diet. We don't provide the diet only once a day. That is provided throughout the day. That is why they are allowed. They need to come to that session during those sessions so that they can observe how we provide the therapy, and they are also instructed that you have to do in this manner. You have to do the thing is this manner. So they are provided a kind of an home-based program which is given to them, and it's explained to them. So how much amount of a time you need to spend on this, and what activity you need to do more, and what is the duration, and they need to follow that routine at home also, because sensory integration is not something which you do it once a day and you will get the results. The parents and even the teachers, they need to give a sensory breaks during the class time, so that the child's sensory integration, we can say the therapy is provided everywhere. It's you need to provide it consistently in the various environment settings.
Okay. और जैसे हमने mud play की बात करी थी, कुछ water play करके भी start करवाएंगे?
Most of the children, through our own experience, we can say that most of the children like the water.
Right.
They are fascinated by the water. So what we say that we want to do you can't remove the play from the therapy. It's always the combination of the both. You do the therapy but in a very playful manner. So what we do, we provide the water play. It gives a kind of because water gives a tactile thing also. When you when you do the play with the water, that gives a kind of a resistance to the hands also, and any kind of not only the hands. When we do this water play in the swimming pool also, so it's a different sensations at the same time. That is a kind of a water play is, we can say, the combination of all the sensory, and it's a therapy. It's one kind of a therapy which we provide.
Thank you, ma'am. Then moving on further.
Then now coming on to the assessment. So which is very important, because depending upon that particular assessment, the treatment would commence. So first is the interviews and questionnaires. Then second is informal and formal observation of the child, and third is standardized testing. So coming on to the first, there are various interviews and questionnaires. It is like interviewing the parents or the caregiver. Whoever is spending more time with the child. And then we have various questionnaires. Like we have CARS, like Childhood Autism Rating Scale.
Right.
Okay. Then there are informal and formal observations of the child. Okay, like informal would be like it would be an unstructured kind of unstructured kind of an observation, in the sense in the natural environment in which the child is usually normally placed. And formal observations, it would be like in the clinical settings, or if we are giving certain structured kind of an activity to a particular child, and then we are making some sense out of that. Then third is the standardized testing. Standardized testing, again, there are various standardized scales, or there are, again, as Nusrat has told, like sensory profile or tactile inventory. So that they are used, their standardized testing is basically to get some objective data, because the other two, they are basically very subjective. So it would be difficult to document our findings and then again to reevaluate after a certain period of time and then to compare the level of the child. So that's why we use standardized testing.
Okay, and ma'am, what do you think? Whether the informal thing is more apt or the standardized testing is more apt?
See, both things are very important. Until and unless there is no research done in a particular area, we can't predict the results. So for the standardized test, I would say these are very important for the research purposes, because we need to know what kind of a therapy is giving what kind of an outcomes.
Okay.
So for that kind, it's very important. For that, we need to document the thing, we need to document the progress, we need to document the things. But informal and formal kind of observation is important, that we need to understand the child also. We need to understand, every child is different. No child will give the honest standardized scale. There are the fixed we need to find, there are fixed questions which we need to stick. But in the informal thing, you can, every kind of a data you can put in.
Right.
Because every child will show a different kind of a symptoms. No two children are similar. So I will say both of them are very important.
And if we talk about like the standardized testing, like the sensory profile which we are talking about, if I can remember, there are also the blank spaces which are left after every column, like after auditory and the visual. So that means, like, if you want, you are having a,
you can add
informal
on them. But
observation.
if we talk about the standardized test, then we have to we have to go through a fixed protocol. You
Right.
can't add on anything, you can't subtract out something. So you have to follow a strict protocol while you're using the standardized test.
Okay, so we'll carry on with our discussion after a short break. See you after a while.
The chief handicap of the blindness is not blindness, but the attitude of seeing people towards them. आइए जानने और समझने की कोशिश करते हैं कि बधिरांधता यानी डेफ ब्लाइंडनेस क्या है। बधिरांधता एक स्थिति है जिसमें दृष्टिहीनता एवं सुनने की शक्ति में कमी आती है तथा जिससे विचारों के आदान प्रदान और रोजमर्रा की आवश्यकताओं की पूर्ति में समस्या उत्पन्न होती है। बलराम एक 9 साल का बधिरांत बच्चा है। वो एक प्री मैच्योर बच्चा है जिसका शारीरिक विकास उसकी आयु के अनुरूप नहीं हुआ था। वो एक निम्न वर्गीय श्रेणी से संबंध रखता है तथा 5 साल से लगातार नेशनल एसोसिएशन फॉर ब्लाइंड दिल्ली के प्रशिक्षण कार्यक्रम से संलग्न है। इन 5 सालों के अंतर्गत उसे रोजमर्रा के कामों में, हलन चलन में, उसकी शैक्षणिक जरूरतों के अनुसार संप्रेषण द्वारा प्रशिक्षण दिया गया है जिससे वो इन सब क्रियाओं में स्वावलंबी बन सके। बलराम बिना किसी सहायता के चाकू से फलों को काट सकता है। उनके छिलकों को कूड़ेदान में डाल सकता है। अपने बर्तनों को खुद साफ कर सकता है। उन्हें सही जगह पर रख सकता है। सही बर्तनों का चयन करके खुद खाना खाता है। एवं पानी की बोतल निकालकर पानी भी पीता है। इन सभी क्रियाओं में वो टेक्चुअल साइन लैंग्वेज से निर्देशों को ग्रहण करता है और अपने भावों को व्यक्त करता है। टेलर फ्रेम और ब्रेलर द्वारा गणित, पठन लेखन में भी प्रशिक्षण प्राप्त कर रहा है। सभी बच्चों की तरह उसका भी एक मनपसंद खेल है। उसे सेल फोन को अपने कानों पर लगाकर उसका कंपन महसूस करना अच्छा लगता है। कहा जाता है, वॉकिंग विद अ फ्रेंड इन डार्क इज बेटर देन वॉकिंग अलोन इन लाइट। कहने का तात्पर्य है कि वो लॉन्ग केन ट्रेवल, टैक्टाइल पाथ, ट्रेलिंग और लैंडमार्क्स द्वारा हलन चलन में भी सक्षम है और व्यायाम संबंधी क्रियाएं जैसे ट्रेडमिल, स्टैटिक साइकिल का स्वचालन भी कर सकता है। कहा गया है, द बेस्ट एंड मोस्ट ब्यूटीफुल थिंग्स इन द वर्ल्ड कैन नॉट बी सीन और इवन टच्ड, दे मस्ट बी फेल्ट विद द हार्ट।
वेलकम बैक। ब्रेक पे जाने से पहले we have discussed about the sensory integrative disorders, and to name them, these are the sensory modulation problems, the problems with discrimination and perception, and the problems with the vestibular processing and the dyspraxia. And as ma'am told that praxis, it means motor planning. So autistic children, they face problem with the motor planning, that's dyspraxia. Then we discussed about the assessment thing. We discussed about the standardized testing, which is basically for the research purpose, and we talked about the informal and the formal observation. Informal observation, it is basically at play, observing the child in his most natural environment, and the formal observation like in the clinical settings. So moving on further, what we are going to discuss next.
Next, we'll discuss about the signs of SI problems. So first is an acute awareness of background noises. Second, fascination with lights, fans, water, hand flapping or repetitive movements. Then we have spinning items, walking on tiptoe, little awareness of pain and temperature. Then coordination problems, unusually high or low activity level. Then we have difficulty with transitions like self-injury or aggression. Then fearful in space, they avoid any physical contact or certain textures. Short attention span and easy distractibility. Then unusual sensitivity to sounds and smells. Strong dislike of activities like brushing the teeth, washing the face, having the hair brushed or cut. So these are some of the SI problems that these children encounter in day-to-day life, and these are again because of the problems in one or the other system that we have already discussed.
And we have discussed these signs, especially.
We have already discussed.
Yeah. Then the next.
Then sensory integration therapy. So there are various types of sensory integration therapy. We can club these into, like, there is individual therapy, there is classical sensory integration therapy, and compensatory skill development. Then we have group therapy, and then we have consultation. Then after giving SI therapy, then what are the expected outcomes of OT? That what are the changes that we are looking for in a particular child? So first, there is increase in the frequency or duration of adaptive responses. Second, development of increasingly more complex adaptive responses. Third is improvement in gross and fine motor skills, improvement in cognitive, language or academic performance, increase in self-confidence and self-esteem, enhanced occupational engagement and social participation, and enhanced family life. So first one is increase in the frequency or the duration of adaptive responses. Like if we are asking the child to give the eye contact initially, maybe say for 2 seconds, then after 3 months or 4 months of sensory integration therapy, that particular time should increase. Okay. Then development of increasingly more complex adaptive responses. More complex in the sense, earlier the child is giving simple adaptive responses like giving a particular eye contact. Then complex, we can make it a little complex by asking the child to do a particular activity in between. Then improvement in gross and fine motor skills. Then improvement in cognitive, language or academic performance. Then engagement in social participation. Again, as the child will improve eye contact, again the social interaction will improve. Okay, saying hello, hi, bye to the children, like imitation, I mean, it is also a very important part. And then again, finally, enhanced family life. Okay, because today we focus on family centered approach rather than a client centered approach.
Right.
Okay, so because the entire family is affected, it is not only the child.
Right.
Okay, so that is it.
Okay.
Thank you.
Then, ma'am, would you like to carry on further with the sensory integration therapy?
Actually, I will focus on the specific areas, because already the Rachna has talked about the sensory integration therapy, what's all about, what do we do. So I would like to focus on the specific areas, like the children are facing the problems during the brushing, during toothbrushing, during hair cutting, and other dressing problems. And so I'm going to discuss about that.
Okay. So let me sum up. So far we have discussed about the autism basically, and what are the different sensory problems which an autistic child faces. And basically these are the problems which not an autistic child face, but it can be with the other disabilities also, maybe the mental retardation or maybe the cerebral palsy. So we have discussed about the somatosensory system, the vestibular system, the auditory system, the visual system. Then we discussed about the sensory integrative disorders, which are modulation problems with discrimination and perception, vestibular processing and dyspraxia. And then we also talked about the signs of the sensory integration. Now we'll further carry on with the somatosensory, the vestibular, the auditory, every system one by one. Over to you, ma'am.
Okay, so this topic we can say that it's a coping with the sensory defensiveness to facilitate learning. See, what we want that if the child is having the sensory defensiveness problem, we want that it should not affect his learning. If we want the child to sit for some time, we need that his sensory integration, that should be in that level, so that he sits for some time, gives us attention and learns something. So let me say what is it was the sensory integration, as already Rachna has said, that it's an integration and interpretation of sensory stimulation from the environment by the brain, and mainly our focus is on 3 areas: tactile, vestibular and proprioceptive. In a very general term, it means that working of the senses in an integrated manner to perform the activities and for the learning everyday life. So not only for the doing in activities, the sensory integration is important, it's also important for the learning, because once you sit, you need for the learning, you need to pay some attention, you need to focus on something, you need to concentrate. For all these things, our sensory integration need to be, it should be integrated well. So let's start with the coping with the tactile defensiveness. How to make brushing, eating, bathing, nail cutting, hair cutting and dressing easier, because all the children with the ASD, they face the problems with all these in these areas. Start with the brushing. We can say that these are the various few tips which we can give to the parents. These are the try brushes of a different kinds of textures. Soak the new toothbrush in a water before use. Vibrating toothbrush may be tried. Massage gum at other times. Try toothpaste powders and gels of a different flavors. So I want to elaborate on this, that the brushing the teeth, it's a we can say that it's a tactile thing, which they are having the tactile hypersensitivity around the oral structures. So what we need to find out, that we need to try the different kinds of brushes. It can be the soft brush if the child don't like the brush in his mouth, so we can start with the soft brush. Even we can do the finger brushing. We can put a towel around our finger and do the brushing around the oral structures, but we should also do the brushing, we should also do that finger massage on the tongue and the hard palate, because these are also a part of an oral oral structures include these also, not only the teeth and the gums. So also the new toothbrush can be put in the water, because the new toothbrush sometimes these are very hard and the child doesn't accept it. So what we can do, we can soak the toothbrush in a water so that it becomes a little soft and the child can accept that thing. And the vibratory brushes, most of the children we can see that the most we have seen that the touch thing, it can be overcome by pressure. When we provide the simple touch or a light touch to the child always shows the aversion. So what we do, we try to give the vibratory brush, because it's more of a pressure, it's more of a vibration which he is getting, and less of a touch thing. So we have seen that the children accept the vibratory brushes and less the toothbrushes which we use. Also the massage gums at the other times, and we can try the different toothpaste and powders or gels of different kinds, because that will change the child may like the toothpaste and he will focus on the toothpaste and less on the brushing, and slowly and gradually he can learn to do the toothbrushing himself.
पर मैम जैसे वाइब्रेटिंग टूथब्रशेस के बारे में बात करी, अगर हाइपर सेंसिटिव है तो प्रॉब्लम नहीं होएगा क्या वाइब्रेटिंग टूथब्रश?
See, we don't start with the vibratory brushes. We always start with a simple massage. When we do a massage, slowly and gradually the defensiveness decreases.
Okay.
Our main focus is on the desensitization. So what we do, that we do the massage and in a very playful manner. We don't want to hold the child and that something कुछ हो रहा है उसके साथ. So what we do, we try to do a massage with the different textures actually, and we also make the child to chew more items, to do the chewing activities more, so that the desensitization thing that is happening, and then we move to the vibratory brushes, because we always tell the parents that you need to do the brushing as normally what we do the brushing after the food, but most of the autistic children, they are they are guided to do the brushing before the meal time, because that will help in the desensitization and the child will take the food comfortably.
Right. Okay. So that's why we provide them the brushing before the meals.
Before the 3 meals, we insist them to do the brushing, so that the hypersensitivity is decreased and the child is not showing the aversion to the food.
Okay. Then moving on further.
So again, instead of a toothbrush, finger may be used, as I have already said. Then the traditional methods, let's say dantun, mustard oil, salt can be used. Make the child drink plenty of water. Avoid colas and chocolates, because we don't want, because they are aversive to the toothbrushing. So we don't want to every time we
Right.
they don't allow us brushing. Or also, why these traditional methods? Because most of the children, they don't spit out.
Right.
After the brushing, they don't spit. So that is most of the parents are very concerned that they always take the toothpaste in. So we tell them to use the traditional methods. So even if he takes in, so it doesn't harm the child anymore.
और मैम जैसे हमने मसाज की बात करी, मसाजिंग द गम्स, दैट विद अ पर्टिकुलर मटेरियल और व्हाट, लाइक यू हैव डिस्कस्ड अबाउट द मस्टर्ड ऑयल एंड ऑल, सो इट्स विद दैट और जस्ट लाइक?
No, it's with a different kind of textures. We can start with a simple cloth. We can start with a towel.
Okay.
Small towel which we use. We can put that on a finger and we can use that. Even the finger toothbrushes are available in the market.
Okay.
With the varying textures, they are available in the market.
But like we have talked about the datun and the mustard oil, many of the children मतलब उस चीज को एक्सेप्ट नहीं करते होंगे, then what to do?
We can stick to those which are available in the market. This is just for those parents who are very concerned that the child don't spit out the toothpaste.
Okay.
So for them we can suggest the dantun, mustard oil and the salt, even if he doesn't spit out, he takes that things in, they are not harmful to the children.
Right.
That's why we have suggested this.
And like more in the rural areas where the proper things are not available, so we can advise the parents
To
try
use
this.
Okay.
Then moving on further.
Then the bathing, because that is also very kind of some of the children don't like the water on their body. So what we suggest for the bathing is try different kinds of soaps, lotions, sponges and brushes. Bath with mugs was the shower if the child wants so. After bath, wrap in a soft towel or a linen. Pat dry if the child avoids rubs. Try to figure out what bothers the child's head bath, rubbing, towel or a soap. It could also be the wet floor that bothers him. So as I said, that the children may show the different kinds of their behaviors, like they don't like the water, or they don't like the lotions, or they don't like the soaps, or they don't like the towel with which they are after the bathing they are rubbed. So we need to find out what is actually bothering them. So most of the time we suggest not to use the shower, because the water comes in a very fast, and that also ऊपर से head से आता है. So what we say, most of the children don't like the water on the face and on the head. So we suggest to use the mug instead of the shower, and also try the different brushes while they are bathing the children, because most of the children like the textures, different types of textures on their body. So we also suggest them to use the different kinds of towels, because that can also bother the child. Also the wet floor can also bother the child. So some times we suggest to place a mat on the floor, so that the child can stand on that, so that it doesn't bother him and the child doesn't feel averse with the bathing. So these are some of the suggestions which the parents can follow, so that they can incorporate these things while they are bathing their children, or the children can use it while they are going for bathing.
Then moving further.
For the dressing, we can say that if the child doesn't like wearing some colors and texture, respect his decision. Child doesn't like wearing woolens, he can wear several loose layers of a clothing, wind cheaters or jackets. Do not let your own desire of making the child look smart bother him in any way. These are some of the tips, because most of the children, they don't like the hard clothes, or they don't like the clothes with embroideries, they don't like the tags, they don't like tight clothes. So we need to respect their decision. It's not something that they are doing it deliberately. It's something which is really bothering them, because due to the textures, due to the tactile receptors are surrounded all our body. So the clothing is one of the major aspects which can affect the children, because their attention will be totally towards their clothes. They will be every time fidgeting, and they will be very anxious. So what we need to do, we need to respect their decision. If they want to wear the loose clothes, we can provide them. There's no harm for making them look smarter. It doesn't, and they are very irritated inside. So we need not to focus on that. We need to respect that thing. And if the child is not wearing the woolens during the winter season, we can provide 1 or 2 layers of the clothes, or we can provide the jackets, loose jackets, or the wind cheaters.
Okay. मैम, ये जो हम डिस्कस कर रहे हैं बेसिकली हाइपर और हाइपो के सेंस में अगर देखें तो इट इज एप्लीकेबल टू बोथ.
Yeah, it's applicable to, because the children who are hypersensitive and they don't want the clothes, still we can tell we can give them the loose clothes, because the loose clothes, they don't they don't have a much touch with the body. And for the hypersensitive who always want to touch, we can provide the different textured dresses, yeah, so that they get that kind of a stimuli every time.
Okay. Then moving further.
Child is comfortable wearing new clothes. Wash them several times before having the child wear them. Child cannot tolerate the seams of the clothes. Socks make him wear these inside out. Labels, tags can be removed. It has been seen that the child doesn't like the new clothes. Many of the parents come to us and they say that whenever we bring the new clothes, the child doesn't want to wear them. We can say that it's mainly because the new cloth, that cloth is very hard and it's fresh. So what we can say, that we can wash that, so that that hardness is removed and the cloth becomes soft, and then we can give that to the child. And if the child doesn't like the inside of the sock, we can make the child wear inside out, so that it doesn't bother him anymore. Also the tags can be removed before we give the child that cloth.
Then can we have a look at the further slide?
Yeah. For the eating thing, we can say that, as I have already told you, that they massage the children's mouth and the jaws before the meals. If the child is a picky eater, then let him feel the food of different textures around mouth. To introduce new food, let the child feel the food, smell the food, touch food around his mouth, lips. Let the child decide whether he wants to eat or not. Respect the child's decision, because eating is also an important component that most of the parents are very concerned. So what we do, we say that child should be given the massage before the food is provided. Also the child should be given the variety in the food, so that if he doesn't like one kind of a food, maybe he can try the other kind of a food. Also the child should be allowed to feel the food, smell the food, because he has to take in. You can't force the child to take any kind of a food. Also you can make the child to feel the food around the lips, in the hands, and then make him eat that thing. So we need to respect the child's decision, but slowly and gradually, as the child gets desensitized, they will accept all kind of a food. Our focus should be that the child should take all kind of a food. There are many parents who said that the child is 5 years old, 6 years old, but still is taking the milk through the bottle, sucking the milk as an infant. So we need to find out that different all these options and make the child to eat all variety of the food.
हम जैसे हम बात करें यहाँ पे सेंसरी इंटीग्रेशन की, आपसे पूछना चाहूँगी कि हमने बात करी कि विद द सेंसरी इंटीग्रेशन सेशन एंड टू बी फॉलो एट द होम टू, ट्रांजिशन जो होता है लाइक टू द अदर प्लेसेस ऑल्सो, ये हमें एट द सेम टाइम ही स्टार्ट कर देना चाहिए, आफ्टर दैट द चाइल्ड इज वेल हैबिचुअल टू द सेशन एज वेल एज टू द होम, लाइक टू द रेस्टोरेंट्स और लाइक टू द विजिटिंग प्लेसेस, अगर हम बात करें तो मैम आपसे.
अच्छा, okay, the transition you're talking about. So see, I mean, first we should make the child comfortable in the clinical setting. Okay, ideally the treatment should focus on the homes, in the home setting first, because that is where the child is going to live. Okay, so if the child is coming to the clinical setting, first we should make him comfortable there, and then gradually we can generalize that, because you are right, generalization is also important, because every time is not going to be at home or in the clinic. So generalization in the restaurants or to any other place, it comes later on, not in the initial stages.
After we have moved the child like more to the normal.
Yeah, I mean, first the child should be comfortable with that particular thing, then only we need to generalize. I mean, we want the child to be comfortable and learn a particular skill before generalizing it to other places.
Okay, then moving on to further slide, ma'am.
Then comes the sleeping. Establish a bedtime routine. Try to maintain it regularly. The routine may include the activities like bath, getting into the night dress, placing a pillow on a bed, story time. Create a calming environment 1 or 2 hours before the child's sleeping time. It has been seen that most of the kids have a problem in the sleep cycle. So we always suggest the parents that the time should be fixed for the sleep, so that the child's, he is fixed to a routine, and also we can slowly and gradually we can create a kind of an environment for the sleep, like we can make the child to change the dress, we can start it with the story time, or also the environment should be calm 1 or 2 hours before the sleep time, because if we do any kind of a stimulating activity in the evening, that will stimulate the child and that may disturb his sleep cycle. So we need to fix on the routine for the child, because fixing on the routines, that will help the child also. And we every time tell the parents that do not change the sleep cycle, because this is a very important point, and you need to focus on these areas before you fix a sleep routine.
Okay.
Nail cutting. Then we nail cutting, it's a very big problem for the children. So cut the nails while he's sleeping, after a bath, by turn taking with another person. Cut 1 nail a day. Let the child handle scissors, nail cutters, etc. We have seen that the nail cutting is a big issue for a child. It's a very simple activity for us, but for the children with the ASD, they have this nail cutting issue, because they're hypersensitive around these fingertips. So whenever you take the nail cutter in front of them, they are very evasive, they don't want to cut their nails. What we can do, we can first when the child is young, and we can suggest the parent that they can cut the nails where the child is sleeping. And the second thing is that we can tell them to do the nail cutting after the bathing, because after the bathing nails are soft, they cut very easily. And we can make the child cut the nails as a turn taking, that if the mother cuts her nails, then she can tell the child, now it's your turn to cut the nail. Also we can cut 1 nail in 1 day, so that that particular activity is not something very scary for the child. And also we can sometimes the children are very they don't like the scissors, they don't like the nail cutters, so we can give them those things so that they can handle these things, and they can slowly and gradually they get desensitized with these kinds of tools.
जैसे अगर अपार्ट फ्रॉम द डिसेबिलिटी थिंग, जो नॉर्मल किड्स होते हैं, क्या उनमें भी कभी सेंसरी इश्यूज होते हैं?
See, in normal children, yes, there are sensory issues. I mean, but these get unnoticed. Okay, so what we talk about the soft neurological signs. Okay, so these are the signs which usually go unnoticed, and later on they create problems in the child. So that's why in the school system, I mean, that's why we have now the inclusive education, or so you know, integrated schools have come up. Okay, so here also the professionals are there who are seeing into these things at a very early age, and then I mean focusing on that particular area, so that later on in their life, I mean, that should not create a problem.
Okay, thank you so much. Then can we have a look at the other slide, please?
There comes the hair cutting. So we need to prepare the child, show a calendar, figure out what bothers the child, avoid overstimulation, haircut at home, let him see others getting a haircut, provide a napkin to wipe face, create pretend situations. So another area which is mostly a concern of our parents is the hair cutting. Hair cutting is an issue because also this area is the head area. This is very sensitive, hypersensitive, that most of the children are very hypersensitive. They don't like the hair cutting. There can be other issues also except the tactile thing. They don't like the scissor, the noise of the scissor. They don't like the mirrors in the barber shop, or they don't like the people around in where the hair cutting is done. So what we need to do, first of all, we need to prepare a child. When the child is prepared, in the autistic, what we have seen, that if the child knows where he is going and what is going to be done, so the child is more comfortable. So we need to prepare a child. We can show a calendar. How we can show that in the month, when we show a calendar, we can tell the child that this is the date when you are going for the hair cutting. So slowly and gradually, when the date comes, the child need to mark the thing, so that he himself is prepared, he or she is prepared, that I am going for the hair cutting. We need to figure out what bothers the child, because that should be addressed while you are preparing the child. If it's a cut of a scissor, if it's a barber, or if it's a mirror, for that also you need to prepare the child. You can tell the child that this is, if I know that scissors are bothering to you, you can show him the scissor also, and tell him it's okay that if you remain seated for 1 hour, then mama will give you this, or then papa will take you there. Also, we can avoid the overstimulation. How we can do that? We can do a haircut at home also. Most of the mothers, they get trained in the hair cutting, because they do that at home, because that there the environment is less stimulating. There are less mirrors, there are less people, there are few scissors, and also we can let the child to see the others cutting the hair. This can make him comfortable also, because he can see that the others are doing the hair cutting very easily. I can also sit and do the haircut. And we can, if the child is having a problem because the hair is coming on the face, we can give the child a napkin to wipe off the hair which is coming on the face. And we can do the pretend situation. Pretend situation is creating a situation. The child is sitting and we are doing a pretend haircut. We are providing a child with that plastic scissor, and we are doing a haircut as a pretend play. In this way, the child gets desensitized in the hair when we do the hair cutting, and he can, slowly and gradually he can learn that the hair cutting is not such a big issue for him.
Then the next thing
is the things that need to be avoided before the bedtime, as I have already told, that it's a stimulating TV programs, loud music, sweet artificially flavored food, rough and tumble games, activities that increase the arousal level. So as I have already told, that 1 or 2 hours before, there should be the environment should be calm, so that the child gets to know that now it's a sleeping time. Also, the loud music should be stopped, and also that sweet artificially flavored food. It's most of the, we can see बहुत सारे घरों में ऐसा होता है that before the sleep time they take the ice creams, and they take the sweet food, they take the sweets, they take the chocolates. all these sweet food we need to avoid, because it has been seen through some of the research that the sweet thing, they are stimulating to the brain. So also we need to avoid the games which are very rough, which are very energetic, we need lots of energy. Also we need to increase the activities that increase the arousal level, that is like TV, computers, or any other type of a game or program that are very stimulating to the brain, because that will disturb the child's sleep cycle.
So far we have discussed about the brushing, the bathing, dressing, eating, sleeping, nail cutting and hair cutting. We'll carry on with our discussion after a short break. See you after a while.
हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन। हो मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन। We shall overcome, we shall overcome, we shall overcome someday. Oh, deep in my heart, I do believe that we shall overcome someday. We shall overcome someday. We shall overcome someday.
The state of knowledge exists. The will, the capacity, and method are usually the problem. मानसिक मंदता एक ऐसी विकलांगता है जो 18 वर्ष की आयु से पूर्व कभी भी हो सकती है, जिसमें व्यवहार अनुकूलता में कमी एवं बुद्धि क्षमता 70% से कम होती है। Alone we can do so little. Together we can do so much. भारतीय पुनर्वास परिषद द्वारा देश भर में पंजीकृत केंद्र इस बात को प्रमाणित करते हैं। NIMH प्रादेशिक केंद्र नई दिल्ली एक ऐसा ही केंद्र है जहां छात्रों को प्रशिक्षण दिया जाता है। जिसके उपरांत वे मंद बुद्धि बच्चों की सेवा में नियुक्त होते हैं। क्लासरूम टीचिंग, ग्रुप टीचिंग एवं भारतीय पुनर्वास परिषद के नव शिखर चैनल पर प्रसारित टेलीकॉन्फ्रेंसेस द्वारा संबंधित विषयों पर विस्तार पूर्वक ज्ञान दिया जाता है। मेडिकल, ऑक्यूपेशनल थेरेपी, फिजियोथेरेपी, स्पीच थेरेपी, साइकोलॉजी और स्पेशल एजुकेशन जैसे क्षेत्रों में छात्रों को प्रशिक्षित किया जाता है। प्रयोगात्मक अनुभव एवं अभ्यास के लिए टीचर ट्रेनिंग प्रोग्राम के उपरांत छात्रों को मंद बुद्धि बच्चों के साथ कक्षाओं में नियुक्त किया जाता है और इंडिविजुअलाइज्ड एजुकेशन प्लान का भी आधार बनाया जाता है, जिससे वे संपूर्ण शिक्षा एवं चिकित्सा शैली को समझ सकें। इस पूरे प्रशिक्षण कार्यक्रम के दौरान विद्यार्थी जर्नल्स, न्यूज़लेटर्स, पेरियोडिकल्स, चार्ट्स, मॉडल्स, कंप्यूटर ट्रेनिंग एवं टेक्स्ट बुक्स का उपयोग कर सकते हैं। कहते हैं, कीप योर फेस टू द सनशाइन एंड यू कैन नॉट सी द शैडो। इसी बात को ध्यान में रखते हुए विद्यार्थियों को सरकारी एवं गैर सरकारी संस्थाओं में नियुक्त किया जाता है, जहां वे मंदबुद्धि बच्चों के लिए निरीक्षण, प्रशिक्षण एवं अनुसंधान का दायित्व संभालते हैं। और इसके पश्चात ये विद्यार्थी इस प्रशिक्षण का उपयोग मंदबुद्धि बच्चों के सामाजिक एवं शैक्षणिक उत्थान एवं विकास में करते हैं और एक लक्ष्य की ओर आगे बढ़ते हैं। और फिर लक्ष्य कितना ही दूर हो, फासला नजरों का धोखा भी तो हो सकता है। वो मिले या ना मिले, हाथ बढ़ाकर देखो।
वेलकम बैक। ब्रेक पे जाने से पहले we have been discussing about the tactile defensiveness, and so far we have discussed about brushing, bathing, dressing, eating, sleeping, nail cutting and hair cutting. Basically जो हम focus करते हैं, we focus on the tactile, the vestibular and the proprioceptor. And जैसे कि मैम ने हमें बताया कि sensory integration, it's integrating the sensations from one's own self and from the environment. So अभी तक हमने tactile defensiveness के बारे में डिस्कस किया. Moving on further, what we are going to discuss next?
The next is the auditory defensiveness. As we can see, the cover the children's ears, use earplugs if the child allows, teach child to cover own ears, take the child away from the situation, desensitize the child by playing the sound bothering the child in the background. Auditory integration therapy may help. As we can see that the auditory is something which is present in the environment. We can't stop the sounds coming in the room or coming while the child is playing, sitting or going anywhere. So what is the best thing we can say, that the child, we can provide the earplugs which the child can put in his ears so that he is, stops the sound coming from the external environment. Also we can make the child to learn how he can, place the own hands on the ears so that he can restrict the sounds. Also we can play the games of slowly desensitize the child by playing the sound increasing games, like where from the toys which are the sound based effects, cause and effect toys, we can provide that to the child during our play. Also the auditory integration therapy, which Rashna has already told us, that there's some fixed protocol, that there are 10 sessions which are given to the child, and also the CDs which are available in the market. So through this we can decrease the auditory defensiveness in the child.
अगर हम मैम घर पे बात करें लाइक होम बेस्ड प्रोग्राम की, तो कैन वी हैव द पेरेंट्स इंस्ट्रक्टेड लाइक जो साउंड्स है क्लैपिंग की, विसल की या बैंगिंग की, उनसे भी करवा सकते हैं हम ये?
हाँ, we can do the child even the simple bell right, which is used. We can also tell the parents that slowly you can starting with the very calm and then moving to the something high frequency sounds.
Okay. And moving on further.
Then these are the play activities to promote the tactile integration. These are activities like water play, large bowl filled, as you have already asked about it. It's a large bowl filled with the soapy water and lots of unbreakable objects, so that the child can play, child can explore the things. These are some of the activities which we can suggest to the parents. Also the finger painting, paint with the fingers, can also mix with the sand, tomato sauce. So sand is like very rough kind of a thing, and the tomato sauce is which can apply on the hand also.
Right.
So these are the play activities which can promote the tactile integration.
Okay. और मैम जैसे एक सैंड पेपर अगर हम यूज़ करते हैं तो व्हाट्स फॉर दैट? जो सैंड पेपर होता है बेसिकली, वो भी मैंने देखा था कि दैट दे वर यूजिंग इन योर इंस्टीट्यूट. वो बेसिकली किस लिए होता है?
That is also for the tactile thing, because the sandpaper is very hard when the child touches that. So the child who seeks the tactile stimulus, so we can give that to the child, so that the child rubs the sandpaper on the hands and fingers. The hands and fingers are we can see that हमने बहुत सारी बातें की about the hands and fingers. It's
Right.
because that most of the activities, I can say many of the activities, all the activities, we use the hands.
Right.
So that's our main focus. Is mostly the hands. The other body parts, they also need the integration therapy, but the hands, because these are all involved in almost every activity. That's why we always suggest these activities to the parents, so that they can do at home also, not in the clinic only.
और जैसे हम सैंड पेपर वाली बात है, अगर हम हाइपो की बात करें तो वी कैन गिव दैट इनिशियली, लेकिन अगर हम हाइपर की बात करें तो वी कैन गिव दैट एट अ लेटर स्टेज.
At a very later stage. I mean, in that case, we will start with cotton, a very soft.
राइट.
Okay, that even with cotton, they will become aversive.
Okay, so we can do that at a later stage
At a
for the
later
hyper.
stage.
ठीक है. Then moving on further.
Sand play, and then sand play is a sand in a large bowl is placed, hide the small objects, toys in it, and child can discover, hide them again and rediscover. Instead of a sand, beans, rice, cornflakes can be used. As you were asking me about this thing, that we were using the beans and rice in our institute, it's in the same thing, that we use the sand in a large bowl and we put the objects in there, so that in the very playful manner, our focus is on the tactile thing, but
Right.
our main is like we are introducing the activities as a play activity, and the child can rediscover the toys from the sand. So this is how we can do the both the things, play and the therapy.
राइट. तो जैसे हम सेंसरी इंटीग्रेशन की बात करें, कैन वी लाइक कंबाइन द एजुकेशनल एस्पेक्ट एंड द सेंसरी इंटीग्रेशन? लाइक जैसे ये बीन्स वाली हमने बात करी कि बोल से बीन्स में से वी हैव टू आइडेंटिफाई द ऑब्जेक्ट्स. सो कैन वी कंबाइन द एजुकेशनल एस्पेक्ट्स प्लस द सेंसरी इंटीग्रेशन वन?
Definitely, we can do that. I mean, like, I had a patient, I mean, who was very hyper to the vestibular input. So what I used to do, and he was coming to me for education also. So what I used to do, I used to make him stand on a swing, okay, a flat swing, okay, and then giving him the vestibular side by side, and then keeping it a block, I mean, a block of different shapes, and then asking him to come and then pick a triangle shape and then give it to me.
Okay.
Okay, so it is like combining. I mean, it is the child is having the vestibular input also. It is the adaptive response that we are asking the child to give. Okay, and it is educational also. It is always better. I mean, in a single activity, we should try as many things to do as possible.
So it's not a sensory integration as a whole, it's a hell lot of other things involved
It is
also.
a holistic approach.
It's a holistic approach.
Yeah.
Then moving on further.
Finger drawing, we can encourage the child to draw the shapes, letters, numbers with the fingers in the sand. This can be done with the sand. This can be done with the other things also. Like finger drawing is important in the sense that it desensitizes the finger area. Also, when the child traces the numbers or alphabets with the finger, they get the impression of that alphabet or letter in their minds.
Right.
So before using the pencil, most of the time we suggest the parents that you should do the finger tracing in the sand, in the other materials also, so that the child can actually know in what direction I need to go when I am copying this letter, or when I am doing when I am writing a number or a letter.
Right. So it can be like if we are presenting a wooden cutout, like A का अगर wooden cutout है, तो it can be like छोटे छोटे dots उसके ऊपर हम दे सकते हैं, like to feel the shape, and that's for tactile defensiveness also.
Yeah.
Okay. Then moving on further.
Feely bag. A feely bag is objects to be hidden in the bag. Child feels and guesses what could be in, and the second is the magic dough, cornflakes, and the water. So these are all for the tactile defensiveness, to decrease the tactile defensiveness. The feely bag is like in the bag you put the various kinds of objects, starting from the very soft to the hard one, and then let the child feel the bag, put the hand in, feel the things, and take the things out and guess the name. This is this activity is important in the sense that when the child puts the hand in, the first thing which he will take is it will be the object of his own interest.
Right.
In this way, we can also find out that what is the thing which the child likes, is the hard thing or the soft thing.
Right.
Because many of the children will, their focus will be on their, when they are exploring the feedback, they will most of the time it happens that they come out with their object of their interest.
Own choice. Okay.
And also the magic dough, that the cornflakes and the water, that we combine the cornflakes and the water and tell the child, we can put in the toys there and we can tell the child to get the toys from there, or we can make, like you said, the mud play. It's a kind of a same kind of a thing, that we
Right.
give them the dough and they play with it. They can tear it, they can do anything with both their hands.
ओके और मैम जैसे हम बात करते हैं ऑटिज्म की बेसिकली, तो देयर आर लाइक टू एंड्स, हाई फंक्शनिंग एंड लो फंक्शनिंग. तो जो सेंसरी इंटीग्रेशन एक्टिविटीज है, क्या इस पे भी डिपेंड करता है, लाइक ऑन द लो फंक्शनिंग एंड ऑन द हाई फंक्शनिंग ऑटिज्म, ऑन द फंक्शनल एस्पेक्ट्स of the autistic
Of
children?
course, I mean, after we do the assessment, then only we will start the therapy. If the child is a high functioning autistic child, then we will start the intervention at that level. Where the child is, the therapy will try to take him at a higher level.
Okay.
So it depends upon that.
और जैसे हम बात करते हैं कि सेंसरी इंटीग्रेशन एंड एजुकेशनल एस्पेक्ट्स जो हमने कंबाइन करे हैं, तो अगर लो फंक्शनिंग ऑटिस्टिक चाइल्ड होगा तो बेसिकली वी विल फोकस मोर ऑन द सेंसरी इंटीग्रेशन पार्ट रादर देन द एजुकेशनल. मींस दैट विल बी
Yes.
ऑफ अ मोर ईजियर लेवल, द एजुकेशनल वन व्हिच वी आर टॉकिंग अबाउट.
No, educational level is not the easier one, we can say. But
लाइक फॉर द लो फंक्शनिंग.
for the low functioning, see, first we should make the child stable. Okay, the educational aspects come later on. Okay, if the child is, if the child is sitting on a chair and if he keeps moving, keeps flapping his hands, has very low attention, okay, so there's no point, I mean, making him do tabletop activities, because his attention won't be, I mean, he won't be able to pay attention to the particular task. So first thing what we do is make the child stable enough, okay, so that he is able to maintain his attention maybe for a short period of time, maybe for 2 minutes, maybe for 5 minutes. Okay, so then once the child becomes stable, then we can start with the activities like any educational activity. But then again there are levels. I mean, we cannot make the child, I mean, who is, I mean, like shapes agar hum sikha rahe hain, the first we'll tell the circle shape.
Right.
Okay, because that is the shape that the
Yeah.
child learns first. So accordingly we'll move depending upon the level of the child, the therapy would start.
Okay, thank you ma'am. And moving on further.
Now there are the proprioceptive activities. We can try the rubbing different kinds of brushes on a body parts, joint compression and the weighted vest. As I have pointed, the rubbing different textures on the body parts. Always there is a one protocol called Wilbarger's protocol, which we follow once we when the brush is rubbed, and then it's followed by the joint compression. So it's a kind of a tactile proprioceptive activity. So and then comes the weighted vest. Weighted vests are like weighted jackets which are provided to the child who seek the proprioceptive inputs. So when the child is given that weighted vest, the child is more settled, more stable and more calm. It has been seen through the various research that the weighted vest can help many of the children. So because this is something which they can put on, it is not they have to hold with their hands. It's something which they can put on their bodies and they feel more comfortable and calm with this weighted vest.
हाँ मैम, जैसे आपने बात की थी सोमैटो सेंसरी सिस्टम की, वहाँ पे हमने डिस्कस किया था पोस्टरल टोन के बारे में. तो अगर हम ऑटिस्टिक चिल्ड्रन के बारे में देखें तो वेदर दे हैव लाइक हाइपोटोनिसिटी और हाइपरटोनिसिटी.
They usually have hypotonicity.
So that's where we use the joint compressions.
No, joint compression, if you're giving joint compression, that will not increase the tone. Joint compression is basically to give the proprioceptive input.
Okay.
I mean, tone can be increased by various other activities like weight bearing in a quadruped position or wheelbarrow position. I mean, making the child lie down prone on the ball and then making him doing wheelbarrow position. So that will increase the tone of the child, or using a trapeze. Okay, that will increase the tone also, and that will provide the proprioceptive input also.
Okay. Moving on further.
Then there are the activities which can promote the vestibular integration. First is the movement activities are important for the vestibular stimulation. First is the swing. Encourage the child to swing in a gentle linear movement. Swinging in a blanket, net, hammock can also be used. Rocking in a rocking chair. Spinning on a tire, merry-go-round or the office chair. Seesaw rides balance or walk on a seesaw, balancing on a large therapy ball, can lie on a back, stomach, sit and bounce. Mainly what the vestibular integration, what we follow is mainly the movement. It can be in the linear way, when the child is moving in a one position from linear throughout the body, including the head and the body, and it can be the other, like the quick fast movements in a round way, in a various different, like I said, spinning and sliding, seesaw, balancing. There are the various kinds of vestibular activity, but also we need to focus on this, the preference of the child. First, what we give is the preference of the child, what the child likes, but our focus is mainly on the what we want. But when we start, it's mainly the preference, and then we move to the further areas. This is how the vestibular integration can be done, but it is not done in a single way. We need to combine the activities: vestibular, proprioceptive, vestibular, tactile. Always there are the combination of the activities. These are some of the very few examples. Other depends on the availability of the thing, availability of at the home, in the park. There are various options for the vestibular thing.
Okay, then moving further.
This is what I have given an example of. This is a therapy ball. The child is sitting on the therapy ball and the therapist is guiding the child. The child sits on his own, but the guidance is from the therapist. This is the head massage. What is a picture of a head massage? The child is sitting doing an activity. The child is given a bowl, and the child is doing the tactile exploration activity, and the therapist is providing the head massage. It's the two activities. There is always a combination of an activities. So it's a two activity with right now the child is doing.
Is the joint compression working here with the head massage?
It's mainly the head massage.
Okay.
We mainly focus on while doing the head massage, we mainly focus on the head area.
Okay.
Then comes the joint compression. Then again, other kinds of vestibular integration activities are tummy down, head up activities. Have the child on a stomach and read book, fix puzzles, plays or scribbles, jogging or somersaults. Somersaults are kind of a hip hop kind of a dancing activity,
Right.
where both the hands are on the ground and the feet are up in the air.
Okay.
So these are the kinds of activities which we can do in the vestibular integration.
Then moving further.
Activities to develop the proprioceptor, as I have already discussed this. This is the carrying loads, jumping on a trampoline, bean bag, mattresses, sand, water tubs. So these are the proprioceptor integration activities. We have already discussed these. These are other, as the Rashna has said, the wheelbarrow walks, and the crawling, tumbling and pouring water, cereals, sand from one container to another. When we discuss about the proprioceptive activities, we mainly said that the activities which need strength. So we say that the wheelbarrow walks, we say jumping, tumbling, but we forget about the hands.
Right.
We forget about the small joints in the hands and fingers and the wrist. So this activity, the pouring the water, cereals in one container to another, this can be the proprioceptive activity related to the hands and fingers.
Okay. So the next thing.
Climbing on jungle gums, walking on bricks, walking on elevated paths, playing with a catch, ball, bean bags. This playing catch with a ball, this is also an activity which includes 2 or 3 things. There's eye-hand coordination, there's a balance, there's a vestibular thing, because you need to hold the hands away from the ground. So there are the 2-3 activities which when we do this catch with the balls and balloons or bean bags. Turning mattresses, moving furniture, sweeps, or this can be the activity wise what the activities we can give to the child. It's not only that in the clinic and the home, anywhere you can do the proprioceptive integration while you ask the child to move the furniture, to turn the mattress or sweep or wash the floor. Activities for oral stimulation. Oral stimulation, when it's a concern of many of the parents that the child is not taking in the food, the child is not chewing properly, or there's a drooling, or they are not sucking properly. So there are some of the activities. First is the blowing bubbles, whistles, flutes, thermocol balls, and sucking, reduce length of the straw, drink milkshakes, kheer by straw, licking lollipops from the corner of the mouth and from inside of the mouth. Games like eating with hands tied at the back, eating with plate or items that are hung. The main three important components which are in the oral stimulation are the sucking, chewing and blowing. These are the three important components which the parent should include while doing an activity. Even the V therapist also consider these three elements. And how we can start, what is the basic level depends on whether the child is likes the chewing activities or whether the child likes the blowing or the sucking. So starting from the preference, again we start from the preference and move to the different areas. We need to include these three elements while doing the oral stimulation. So when the parents come to us, they say the child is not chewing properly, but when we ask them is the child sucking or blowing, they say they must not have noticed, or they say no. So it's not only the chewing which we need to focus, we need to focus all the three areas.
Right. अब मैम जैसे अगर like if the mouth remains open, तो बेसिकली एक चीज़ लाइक हमको जब हम लोग पढ़ रहे थे तो हमको सिखाई थी डू लाइक दिस प्रेशराइज एरिया, सो दैट्स आल्सो सेंसरी, इट्स एन एक्टिविटी.
It is not sensory integration, it is just a technique that is used. I mean, the child who keeps his mouth open, I mean, is basically because of the low tone. Okay, so there are various other activities like icing or brushing inside the mouth that can be used to increase the tone of the oral and perioral areas.
Okay, then moving on further.
Visual defensiveness, we can suggest that if the child is sensitive to the bright light, use dark glasses. Keep check on the intensity and quality of a light in the child's room. Use colors and patterns according to the likes of a child. Okay, so for the visual defensiveness, we can say that since the child is sensitive to the bright light, so what we can use the dark glasses. When the child comes out in the sunlight, most of the child they develop pattern of doing this, blinking their eyes. So once it comes into their pattern, into their behavior, it's very difficult to take it off. So what in the early when the child starts doing it, it's better to start using the sunglasses, because that will prevent the child from doing this.
Okay.
So this also, while the child is sitting in a room, we need to focus on the intensity of the light, how much the intensity of the light is. So when the child is working or when the child is playing, because child should not develop an inappropriate behaviors.
Right.
Also that we can use the colors and patterns according to the child. Most of the children we have seen, they don't like the bright fluorescent colors. So what we can use the soothing colors for the clothing, for the plates, for anything else in the environment, in the home environment. We can change all these things, we can modify according to the child's needs.
और जैसे आपने हमें यहाँ बात करी डार्क ग्लासेस की, तो इनिशियली द चाइल्ड मे बी ही इज नॉट लाइक एक्सेप्टिंग द डार्क ग्लासेस, तब क्या करेंगे बेसिकली अगर वो एक्सेप्ट नहीं?
We can provide the caps also, caps, the sun caps. We can provide the hats also, and for the girls most of the time we suggest to place a dupatta.
Okay.
Because this is something in a very playful manner, they will place a dupatta on there, and instead of doing this, because see, anything which they do with their own body part, we should not allow them doing that inappropriate thing which they are doing, because we can remove the thing but we can't remove the body part then.
Right.
When they develop this pattern of a behavior, that we can't remove that body part. If they have started doing this, we can't make them open their eyes, but once they are sensitive enough, desensitized with the sunlight, we can remove the sunglasses, we can give them the hats, we can change the material, we can't change the body part.
Again, the person, I mean, if the child is hypersensitive to touch, then only he will not allow the dark glasses. If he is hypersensitive to the visual thing, he will definitely allow.
Right.
Okay?
That's a point to be noted.
Yeah.
Then moving on further.
These are some of the activities, as the jumping on this jump island. The child is holding with hands and the child is jumping on this tire. So there are the two combination of 2-3 activities. Child is holding with hands with the strength and the child is jumping. So vestibular, proprioceptive and tactile, because the child is jumping with the bare foot.
Right.
This is the wheelbarrow walk which we are talking about. This we can done on, the child is hands on the floor and the therapist is holding in through the hip area and the child is walking on the floor. We can change the texture of the floor if the child we want. This is the two activities right now. First the vestibular thing and the proprioceptive thing, but we can make all the three tactile thing by changing the texture of the floor.
Right.
And this is the therapy ball, how we use the therapy ball with the small children and with the other children also.
So we can have a carpet like laid down.
Yeah, we can have the carpet, we can have the mats,
mat.
we can have other things also, mattress or other with a different texture, so that the child walks with hands on them.
Okay. Then moving further.
This is the therapy this is the ball pool. It is, it's an enclosed area where the child is put in, and there are the various balls. It's also very calming activity in the sense that when the child goes in, there's a what we said, the visual perception. There's
Right.
a one point what we said, the depth perception. When the child goes in and he feels that depth, that he has gone in, and the vestibular thing also, that when the child is in, he feels more calm. He's enclosed by an area, and the child is having the balls for the tactile exploration. This is the most of the time we have said the child is very calm in the ball pool.
Okay.
Also the tactile stimulating activities are there. There are the balls, so that the whole body is inside the ball pool. He gets stimulation all over the body.
Okay. So we discussed. You want to add more? Or is that over? Okay. So in today's session, we discussed about the different sensory issues basically, and how to intervene these sensory issues. We talked about the somatosensory system, which combines the proprioception and the tactile, and we also discussed about the postural tone, the postural responses. We talked about the equilibrium. Then we discussed about the vestibular system. If we talk about the somatosensory system, then the receptors are around the joint area, and if we talk about the vestibular system, then the receptors are within the hair cells. And then we discussed about the visual system. Basically deals with the rods and the cones. And the auditory system, basically it controls the orientation of the head and the body to the sound coming from which direction. Next we talked about the sensory integrative disorders. Basically these are with the modulation problems. Then we have the problem with the discrimination and the perception. Then the problem with the vestibular processing, and then the dyspraxia. Dyspraxia basically, praxis means motor planning. So the children, they have a problem in planning out their activities. Like if there are obstructions in their way, they're not able to plan their way. And like for daily living activities, like for going to the toilet or going to the brushing, and for daily living activities, they're not able to plan their motor activities. Then we discussed about basically the signs of the sensory issues and the sensory problems. And basically what is sensory integration therapy? It combines, like it integrates the sensation from one's own self and from the environment. And then we discussed about, we mainly focus on the tactile, the proprioceptive and the vestibular thing. We discussed about the tactile defensiveness, in which we discussed about the issues with the brushing, the bathing, the dressing, eating, sleeping, nail cutting and hair cutting. Next we discussed about the auditory defensiveness. Basically we discussed about what are the activities which to be followed by the professional, or like in the home-based program to be followed. And we also discussed like transition. It's also very necessary, like apart from the clinical settings or apart from the home-based situations. Once the child acquires like a normal continuum, then we can progress on to the general transition based activities. Then we discussed about the water play and the finger painting. We discussed about sand play, the finger drawing, the feely bag, magic do activities, proprioceptive activities, vestibular integration, oral stimulation and the visual defensiveness. So that's all for the today's session. But before that, I would like to thank both of you coming over here and discussing with us. Thank you so much. And thank you viewers for maintaining with us. Thank you so much. हो गया मैम सारा?